injections. We get a lot of questions regarding unusual uses of Botox. So we compiled some of the most unusual, uh, uncommon uses of Botox. And when we talk about Botox, we're really talking about a class of agents called neuromodulators. And these agents are wonderful in making us look more youthful, in treating lines and wrinkles. But again, there's many other uses of these medicines. So we hope you enjoy the video. If you do, give us a thumbs up. Please subscribe to our channel so you stay current on all the newest cutting edge kinds of treatments in the field of cosmetic medicine. And feel free uh, to send us questions and comments below or to info@reflectionscenter.com. So here we go. Question one.
Okay, John and Clinton asked, I always have struggled with sweating, and I know there are some treatments out there, but I've also read reviews and it seems like nothing is permanent. Is it true that Botox can be used for this problem? How long does it last, and what are the chances of it working?
Great question. So, in terms of Botox for sweating, well, first of all, within this class of agents called neuromodulators, there's Botox, there's Dysport, there is Xeomin, and the new kid on the block is called Juvo. So, these are all similar agents, and each has unique attributes. So, some have specific advantages. For underarm sweating, we typically use either Botox or Dysport, and they work phenomenally well. They last for 6 months. The result is incredibly predictable and incredibly safe. In over a decade of using these for underarm sweating, I literally have never seen a complication, and the success rate is incredibly high. Unfortunately, with some of the other technologies out there, the results are hit or miss, and we definitely see some problems. The big question is, how does it work? And the answer is, we really don't know. We're not sure why it works, but it works and it makes people really happy. The result kicks in just after a few days and it lasts a solid 6 months. After repeated injections, 6 months, a year, 2 years later, it can actually last a lot longer. So, great treatment for underarm sweating. We also use it a little bit in the hands and feet. Unfortunately, it's a very uncomfortable treatment in the hands and feet, so we don't use it a lot. In the underarms, it's an extremely comfortable treatment and very popular.
Okay, next question. Celeste from Franklin Lakes wants to know if Botox works for migraines, and if so, how?
A great question about migraines. So, Botox and Dysport for migraines, another great treatment. And guess what? Another situation where we really don't know why it works. We call this vitamin B. We really don't know why it works though. And what, in my experience of doing this, and I've been injecting Botox now for over 2 decades and in excess of 100,000 patients at this point. And what's interesting is when a patient sees a neurologist, they'll use a very large quantity of Botox, hundreds of units. And oftentimes patients look very frozen. They may complain of some neck weakness. It just cosmetically, it isn't a great result, though the reason they're injecting them is for migraine improvement. Well, the bottom line is when we inject patients for cosmetic benefit, very, very often migraines improve. So I tailor the treatment to migraines, but we keep in mind that we're looking for a good aesthetic result at the same time. So it's something that patients should seek their doctor for care of their headaches, but when they're not responding to typical medicines, think about Botox and Dysport because it works great.
Okay, Nicole from Bergen asked if there's any injection that actually helps reduce enlarged pores.
So great question about enlarged pores. Talk louder. The enlarged pores are a common complaint that people have, and we typically use good topical agents. We use technologies like lasers, but today with injectables being as popular as they are, patients are always asking, is there an injectable that treats pore size? And guess what? Botox again. And for the third time in a row, we're not sure why. Here we use micro droplets, very, very small amounts of Botox throughout the face, and we put them in with a tiny dropper, something we call uh, an aqua gold. It's a little glass dropper that has tiny little needles at the tip. smaller than the diameter of hairs. And it's something that is very comfortable, it's very quick to do, and patients very predictably see increased uh, smoothness of the skin. They see fine lines dissipate, and they see their pores improve. Great question.
Cheryl saw a video on microbotox for rosacea and wants to know how that procedure works.
So microbotox means putting very small amounts of Botox or Dysport into the skin. And one of the great indications for it is redness or flushing or inflammation. We still want patients to do the normal set of things, topical agents, technology. But if someone is having resistance to these agents, that they're just not working or they're not working anymore, we move to Botox. Very small amounts diffusely through the skin, and we see improvement very predictably. Great question.
Up next, Joan from West New York says, my dentist says I have a problem with clenching and wants me to wear a night guard, but I hate that idea. I've seen a lot of celebrities talking about Botox for TMJ and bruxism.
So, in our world of stress, we tend to clench a lot, especially at nighttime, or we may grind our teeth. Sometimes patients aren't aware, but when they go to the dentist, they're told that their rear teeth have been ground down, or they're having pain in their TMJ or temporomandibular joint. And it's something that is very common from grinding at nighttime when people sleep. So one of the great treatments for that is injection of Botox into the masseter muscle, into the muscle on the side of the face. By shrinking that muscle a bit and decreasing the strength of that muscle, we see predictable improvement in pain that people have on the side and the clenching, and it makes the joint over here, the TMJ, and the teeth age much, much better.
The next question we have is Sarah from West Deptford. She would like to know if Botox can really improve acne.
So improving acne is something that we're all actively working on. There's a couple of new technologies that are just about to hit. And one of the things for acne cysts are to use a small amount of Botox directly into that cyst. And studies have shown that we can improve that cyst. It's not being used over on the entire face for acne, well, at least not as yet, but it's something people are studying.
Next, we have Christina, and she said she's seen videos on Instagram that some doctors actually inject Botox instead of fillers into the lip. What's that about?
So fillers are to increase the volume of the lip or the projection of the lip. And we want to do that in very natural looking ways. However, sometimes patients will complain of lip lines, vertical lip lines in the white part of the lip caused by pursing. So that's something we're able to use small amounts of Botox to slow down that excessive pursing, as well as tiny amounts of Botox along the border of the lip, and that causes what we call a lip flip, or an inversion or projection of the lip, where you see more red of the lip. So these are two very common things. The third being a gummy smile. When some patients smile, they see gums, and it's something that bothers a lot of people. It's something we see in family. So by putting tiny amounts of Botox in either side of the nose, we can very easily treat that gummy smile.
Tina from Warren wants to know what injectable can be used to slim her face.
So facial slimming using Botox and Dysport has been something that has caught on, and it's something that's becoming extremely popular. Sometimes patients will notice that their faces are becoming square. That can be genetic, or it can be secondary to clenching and grinding at nighttime. By using Botox in a very careful manner in the muscle on the sides of the face, we can actually slim the face and change the appearance into a more youthful and a more pleasant looking appearance.
Tom from Raritan asked what injectables can be used for scars.
So we use different types of injectables for scars. If a scar is depressed, we may use a dermal filler to lift that scar up. But the other thing we can do with someone that is prone to develop bad scars, even keloids, is inject that scar with Botox at the time of injury or surgery. So studies have shown that Botox can make that scar heal much better, much more smoothly, and can decrease the risk of a keloid or what we call a hypertrophic or thickened scar from forming. But it should be done as soon as possible. Great question.
Our next and last question comes from Beta from Summit, and she would like to know if there are any injectables that can be used instead of a nose job.
So the use of Botox or Dysport or now Jeuveau for the nose is really fun. And one of the things it can do is actually tilt the nose up about 15 to 20 degrees. Not everyone's a great candidate for that. So the one little exercise that we try is we have a patient say P or B repeatedly. And if their nose dips down when they say P or B, if we put just a couple of units at the base of the nose, they'll notice over a few weeks the nose starts to tilt back up. So it's a great thing if someone wants to try that out before having some kind of surgery. And also, if there's a bump in the middle of the nose, we may use a dermal filler on either side of that lump to straighten out the nose. So these, again, are tools we can use in place of surgery, and also if someone is contemplating surgery, to do something that would be temporary to see if surgery is indeed something that will make them happy. Thank you so much for all the questions. These were awesome. These are some of the unusual, not the customary things we do with Botox, but there are things that you should ask about when you're coming in for your visit, whether it's the jawline or the nose or elevating a brow or turning the lip out or treating the dimples of a chin. There's so many other uses of Botox. And health-wise, underarm sweating and migraines, spasticity of muscles, most of the things we do with Botox, we still don't understand exactly why they work. But what we do know is they make people happy and feel better about themselves. Thank you so much for joining us.